started your timer and here is your question. Right, so if you have read and understood, considering its surgical anatomy station, kindly tell me what are you looking at? If you can, picture A and then picture B. Yes, it says above here, but ignore that, please.
So it's a gross anatomy of right popliteal fossa.
Right. Can you, would you be able to identify structure 1 here, or can you please tell me the boundary of the popliteal fossa, please?
Superolaterally, it is made by biceps femoris. Superomedially, semimembranosus and semitendinosus, and inferiorly, it has medial and lateral head of gastrocnemius. Roof is formed by skin and fascia lata, and floor is formed by capsule of knee joint, popliteal surface of femur, and fascia covering popliteus muscle.
Okay, what are the contents of the popliteal fossa from superficial to deep, please?
It contains tibial and common peroneal nerve, popliteal vein, and popliteal artery. Also, it contains some superficial lymph nodes and short saphenous vein going into popliteal vein.
Okay, can you please tell me the identification of structure mark 15, please? In picture A.
Yes, ma'am. Ma'am, it's a sciatic nerve dividing into tibial and common peroneal nerve.
Okay. Tibial nerve, oh, yes. All right, can you please also identify number 1?
It's biceps femoris.
Yes, can you please tell me the attachment, nerve supply and action of the muscle?
Yes, ma'am. It's inserted into the head of neck of the fibula.
First
And,
of all, remember it has 2 heads, long and short. Kindly tell me individually, please.
The long head originates from ischial tuberosity.
Very good.
And the short head from the posterior surface of the femur. And
Yes.
it's inserted into the head of fibula. Nerve supply is by sciatic nerve and also certain branches from tibial nerves. And blood
What is
supply
the
is by
action?
popliteal.
What is the action of this muscle, biceps femoris?
Extension of flexion of knee joint and extension at the hip joint.
Yes, and lateral rotation as well of the knee joint. Okay, can you please tell me what you understand by, where is the word? Lineastro.
It's a semilunar fibrocartilaginous tissue inside the joint capsule. It is intracapsular and intrasynovial.
Yes.
And there are 2 menisci, lateral and medial.
All right. Can you please tell me how how the knee joint is formed?
It's formed by articular surface of the femur, and the tibia, superior articular surface of the tibia.
Okay. What are the structures which strengthen the knee joint?
It's joint of knee capsule, the superficial and deep part of medial and lateral collateral ligaments of the knee joint, then anterior and posterior cruciate ligament, and meniscus.
Okay, right. Can you please tell me what are the if there is a mass present in the popliteal fossa, what are the differential diagnoses that you'll consider?
The cyst, it can be schwannoma, it can be
Okay.
popliteal artery aneurysm, or
Yes.
varicosity of short saphenous vein, lipoma.
Okay, right. Popliteal fossa, lymph, it drains, the lymph is drained into which lymph nodes?
The drainage area involves the drainage area of the short saphenous vein,
Very
that is
good.
posterolateral of the
Okay,
in the neck.
right. Good. Can you please tell me the origin and insertion of quadratus femoris muscle?
It's on the lateral surface of the upper part of ischial tuberosity, and insertion is into the quadrate tubercle of the femur.
Okay, right. What more I have to ask you? Okay, tell me about the patella.
Patella is sesamoid bone, and it
Yes.
is inside the tendon of quadriceps femoris.
Okay.
It also associated with lower anterior surface of the femur.
Yes.
And in cases of knee joint effusion,
Yes.
we can do multiple tests related to patella, such as
Yes.
the swipe test, patella tap test, and ballotment test.
Okay. In case if there is a patellar fracture, how can you confirm it and what should be the treatment?
There would be a crepitus on the joint surface
Yes.
on palpation, and also on X-rays. It would be antero-posterior and oblique X-rays. I would like to confirm fracture of the patella.
Yes. Okay. Can you please tell me how many compartments there are in the leg?
There are 4 compartments in the leg.
Yes. Yes.
And anterior, lateral, and
Yes.
superficial and deep posterior compartment.
Okay. What are their what are the contents? What are in each compartment? What are the muscles?
In anterior compartment, we have tibialis anterior, flexor extensor digitorum longus, extensor hallucis longus, and peroneus tertius. In posterior compartment, superficial part, we have gastrocnemius, plantaris, and soleus. In deep part, posteriorly, we have tibialis posterior, flexor digitorum longus, flexor hallucis longus, and popliteus. And in lateral compartment, we have peroneus longus and peroneus brevis.
Okay, can you please tell me how would you, in a patient, how would you test the knee reflex?
The patient is asked to expose up to the thigh, exposing the thigh, and the foot is not supported, relaxed, and off the ground. And we tap with the testing hammer on the patellar tendon, and we check for reflex contraction in quadriceps femoris muscle.
What is the nerve root of knee reflex?
It is L3, L4.
Yes. Good. Okay, what are the movements which are present at the knee joint?
It's a flexion, extension, and slight internal and external rotation.
What type of joint is knee joint?
It's a synovial joint of hinge, modified hinge variety.
Yes. What are the characteristics of synovial joints? Why is it called synovial joint?
It is lined by synovial membrane and it contains synovial fluid.
Yes, good. Okay, right. What are the blood supply of menisci?
It's from lateral, superomedial and superolateral, and as well as inferomedial and inferior. Oh,
Okay.
sorry.
All right.
It's from the branches of tibia.
Okay. What are the
Uh,
purpose that these menisci serve in the knee joint or in the stabilization of the knee joint?
It helps in distribution of load and by increasing efficiency of the surfaces.
Yes.
Also, it acts as a cushioning effect.
Yes.
It has collagen, type 1 collagen,
Yes.
and it protects underlying hyaline membrane of the joint, preventing osteoarthritis and degenerative changes. And also,
Yes.
it has some lubricating property
Good.
for easy movements.
Good. Okay, can you, Bell has gone, but since you were, and I was asking quite softly, so we can maybe ask, can you tell me the structures which pass behind the median malleolus?
It's a tendon of tibialis posterior, flexor digitorum longus, flexor hallucis longus, posterior tibial artery, and also just behind the lateral malleolus, we have
Yes.
tendons of peroneus longus and brevis.
All right. Can you please tell me how would a patient present if there is entrapment of common peroneal nerve?
Patient will present with a loss of sensation in the lateral part of the leg and also the dorsum of the foot, and there would be loss of eversion and foot drop, unable to dorsiflex his ankle.
Okay, if a patient has a fracture of tibia and a patient presents with susceptible compartment syndrome, how would you confirm which compartment is involved?
On passive stretching or,
Yes.
dorsiflexion, there would be, if there is severe pain, it would suggest the involvement of posterior leg compartment. And on plantar flexion, it would be suggestive of anterior leg compartment.
Okay, good. Thank you so much.
Thank you, ma'am.
Question?